Did you know that some common medications could increase your risk of memory loss and even dementia? While these drugs are often prescribed for legitimate health conditions, prolonged use or high doses can have serious effects on brain function, especially in older adults. Many people assume that if a doctor prescribes a medication, it must be completely safe, but the long-term effects on cognitive health are often overlooked. Some of these drugs interfere with neurotransmitters, disrupt sleep patterns, or even reduce blood flow to the brain. If you or someone you know takes these medications regularly, it's crucial to stay informed. Just a quick reminder, we are not medical doctors. This video is for informational purposes only. Before we dive in, make sure to like this video, subscribe to Health Info Hub, and turn on notifications so you never miss important health updates. Now let's get started. 1. Anticholinergic. Anticholinergic work by blocking acetylcholine, a neurotransmitter essential for memory and learning. These drugs are used for allergies, such as diphenhydramine, also known as Benadryl, motion sickness, and overactive bladder. Long-term use, especially in older adults, has been linked to cognitive decline. Studies suggest that prolonged use may increase the risk of dementia. It is advisable to explore alternative treatments with fewer cognitive side effects. 2. Benzodiazepines. Benzodiazepines, including Xanax and Valium, are prescribed for anxiety and insomnia. While they help with relaxation, long-term use can slow brain activity, leading to memory problems, confusion, and an increased risk of falls in older adults. They can also lead to dependence, making it difficult to stop using them without withdrawal symptoms. Safer alternatives, such as cognitive behavioral therapy for anxiety and sleep, may be worth considering. 3. D drugs, non-benzodiazepine sleep aids. Drugs like zolpidem, Ambien, work similarly to benzodiazepines and are used to treat insomnia. Although effective in the short term, prolonged use can lead to cognitive impairment and memory issues over time. A natural sleep routine is a safer alternative. Some users report experiencing sleepwalking or other unusual behaviors while on these medications. Developing good sleep hygiene, such as limiting screen time before bed, may help reduce the need for sleep aids. 4. Proton pump inhibitors, PPIs. PPIs, such as omeprazole, Prilosec, and esomeprazole, Nexium, are used to treat acid reflux. However, studies suggest that long-term use may interfere with vitamin B12 absorption, potentially increasing the risk of dementia. Additionally, chronic use has been linked to an increased risk of kidney disease. Patients should consider dietary and lifestyle changes to manage acid reflux naturally. 5. Tricyclic antidepressants. Older antidepressants like amitriptyline and motriptyline have anticholinergic effects, which can impair cognitive function. If you're taking these medications, consider discussing newer alternatives with your doctor. Newer antidepressants, such as SSRIs, tend to have fewer cognitive side effects. Therapy and lifestyle changes may also help manage depression effectively without medication. Just a quick reminder, we are not medical doctors. This video is for informational purposes only. 6. Antipsychotics. Drugs such as risperidone, Risperdal, and olanzapine, Zyprexa, are used to manage schizophrenia and bipolar disorder. However, they are sometimes prescribed off-label for dementia-related behavioral issues, which can actually worsen cognitive decline. These medications also come with an increased risk of stroke in elderly dementia patients. Behavioral therapies and environmental modifications may provide safer ways to manage symptoms. 7. Statins, cholesterol-lowering drugs. Statins like atorvastatin, Lipitor, and simvastatin, Zocor, have been reported to cause memory fog in some individuals. While research on their link to dementia is mixed, patients should monitor their cognitive function and discuss concerns with their doctor. Some studies suggest that discontinuing statins can reverse memory issues. A heart-healthy diet and regular exercise can help manage cholesterol levels naturally. 8. Anticonvulsants. Medications like phenytoin and topiramate, used for seizures and nerve pain, can sometimes lead to brain fog and slowed cognitive processing, particularly in older adults or when taken in high doses. These drugs may also cause dizziness and coordination issues, increasing the risk of falls. If side effects become problematic, adjusting the dosage or exploring alternative treatments may be necessary. 9. Antihypertensive, blood pressure medications. Some blood pressure medications, especially beta blockers, may cause mental sluggishness or fatigue. While managing blood pressure is vital for brain health, any cognitive side effects should be reported to your doctor. Alternative medications or lifestyle changes, such as reducing salt intake and exercising regularly, may help control blood pressure with fewer side effects. 10. Over-the-counter sleep aids and pain relievers. Medications like Tylenol PM and Advil PM contain antihistamines, which can cause drowsiness and confusion with frequent use. Long-term reliance on these drugs may contribute to memory problems. These medications can also disrupt natural sleep cycles, leading to poor quality rest over time. Exploring natural pain relief methods and sleep-supportive habits may reduce dependence on these drugs. Why these medications affect the brain? As we age, several factors make certain medications more likely to affect the brain. One key reason is the weakening of the blood-brain barrier, which becomes more permeable over time, allowing drugs to enter the brain more easily. Additionally, older adults tend to metabolize medications more slowly, which increases the risk of side effects. Some drugs also disrupt neurotransmitters by blocking or altering important brain chemicals like acetylcholine and GABA, which can impact memory and cognitive function. The effects can be further amplified when multiple medications are taken simultaneously, as drug interactions can heighten cognitive side effects. Moreover, underlying health conditions such as diabetes, kidney or liver disease, and a history of strokes can make individuals more susceptible to drug-induced cognitive decline. How to reduce the risk to protect brain health? It is essential to regularly review medications with a doctor, including both prescription and over-the-counter drugs, as well as supplements. Considering safer alternatives for sleep, anxiety, or pain relief can also help minimize potential risks. Maintaining overall brain health is crucial, which can be achieved through physical activity, a balanced diet, and engaging in cognitive exercises. Additionally, monitoring vitamin B12 levels is important, as deficiencies can contribute to memory problems. When possible, reducing unnecessary medications under medical supervision can further lower the risk of cognitive side effects. Some commonly used medications may accelerate memory decline, but being informed allows you to make safer choices. If you or a loved one is taking any of these drugs, consult a healthcare professional before making any changes. Keep in mind that we are not medical doctors, and this information should not be considered medical advice. This video is for informational purposes only. It is always best to check with your doctor for medical advice and treatment. They will know more about your individual condition. Help spread awareness by liking this video, sharing it with others, and subscribing to Health InfoHub for more valuable health content. Thanks for watching, and we'll see you in the next video.